quite well. On behalf of the, I'll just start. So thanks for joining us for the first of the Nurse Digest sessions. My name is Margaret Dempsey and I work with APNA. APNA is collaborating with the Australian Digital Health Agency to bring you Nurse Digest, a monthly series of bite-sized education sessions with a nominated topic and interactive question and answer section. Firstly, I would like to acknowledge, on behalf of APNA, respectfully acknowledge the Aboriginal and Torres Strait Islander peoples as the traditional custodians of the lands across which we meet, and pay my respects to their elders past, present and emerging. I'm currently bringing this to you from Wathaurong country in Victoria. Just to let you know, if you do have any questions, please put them in the chat box and we will get to those towards the end of the session. I'd now like to introduce our guest for today's session, who is Carey Doolan from the Australian Digital Health Agency. Welcome, Carey.
Thank you, Mark, and thank you everyone for joining us on a busy day today. We've had a huge interest in My Health Record and other digital tools during the COVID period. We actually educated more people during the COVID the original COVID 3-month shutdown than we had educated all of last year. I work at the Australian Digital Health Agency. We, of course, work on the My Health Record system as the system operator, but there are 6 other kind of key areas of our work plan that we work to for the states and territories of Australia that make up the Council of Australian Governments. That is secure messaging, so things like Argus, HealthLink, medical objects, that there are moves to make the capability for finding more providers on address books for secure messaging over the next 18 months. Interoperability, so we are working on a framework for action in regards to interoperability. We recognise that there's a tremendous amount of technology and software out there in the health space. We want to join up more of that data so it's more meaningful and more real time and available where it's needed as it's needed. Medicine safety, we have a significant program example there in regards to electronic prescriptions. And we do enhanced models of care to test out My Health Record in a whole range of different environments and different combinations of health sector types. Education, we will educate anywhere, anytime. Feel free to contact us via our Australian Digital Health Agency Help Centre for inquiries about education, webinars, etc. For your colleagues. And we participate in innovative conversations globally, currently with a forum that has about 30 countries represented. So many of you are probably familiar with My Health Record, but we do come across a lot of providers that are still not that familiar with My Health Record. So it is a summary of a person's key health information. It's not detailed clinical notes. It's not a portal to view all the detailed clinical notes of the general practice or of the hospital, but it's a patient's record, an electronic record for the patient. The hospital has its own electronic record. You have your own electronic health record in best practice, medical director, others, etc. But this is a record for the patient that we can send some information to and also view information. So basically think of My Health Record that if you don't have information about the patient in front of you, think My Health Record for bonus health information. It's personally controlled, which is a key element of the My Health Record system. Individuals can go in and choose what's in their My Health Record and choose who has access to it. They can choose whether they've even got a My Health Record or not. It's part of a national system, so the same My Health Record information that can be viewed by nurses in Victoria is the same My Health Record information that can be viewed in your practice, wherever you are joining us today. It's accessible at all times, as you'd expect from any electronic system, and it's protected through legislation, primarily the My Health Record Act, and the highest of security protocols through our cybersecurity centre and a whole range of layers of security that we apply to the My Health Record system. This gives you a bit of a full picture of what's in the My Health Record, or what you could find in the My Health Record. This kind of represents the different parts of the record that can contain information. The key thing I want to point out here is that there's kind of three key sources of information. There's clinical documents that are provided by providers, so general practices, hospitals, community pharmacy, allied health, aged care, amongst others. Patients can go into their My Health Record. They can state what medicines they're on, allergies, adverse reactions, as well as they can place an advanced care plan in their My Health Record. And also the Medicare system has an auto feed of MBS item claims, PBS claims, so you can get a picture as to where has the patient been presented before, and what medicines have they been on. Immunisations register. Nurses tell us that they can get into the AIR quicker through My Health Record than they can through PROTA or other means. I'm going to demo a little bit based on a small case study. If we think about a gentleman by the name of Caleb, who's 87 years old, and he's moved into a retirement village in your area, and so your practice is going to be seeing Caleb. You find out from Caleb that he survived a COVID-19 episode in April. So if he's a new person, you'd be interested in his history. So we're going to have a look at My Health Record and have a think about where we would look in the My Health Record for COVID history. So if I dive into a commonly used software type, I'm just going to dive into best practice for this demo. So there's a few key ways of accessing My Health Record. Primarily, there is the My Health Record icon. In most systems, there is a button or a place to press to access My Health Record. In this example of best practice, we've got an icon called the My Health Record, and we can simply click on that to open it up. Alternatively, we do have another pathway through this My Health Record tab. And also there is a prescription and dispense view of My Health Record as well from the Recs section of best practice. We've got here what we call the document list appearing immediately. We can view the latest shared health summary. Key thing to be aware of is the filters. The filters have a date range, and that becomes significant when you're viewing different documents. In order to see the full picture, you want to set an older date range, and then we can update that. And then it gives us more of a full picture. So the sort of things, so for a new patient, the most popular part of the My Health Record is the medicines information view. This is what more providers access in the My Health Record than any other part. It's got, the My Health Record fills a very unique space in regards to bonus health information about a patient's medicine history. Not only does it have the PBS history, any medicines that have been uploaded from a hospital, pharmacist, GP, but also it has private prescriptions. So that fills a massive void in regards to medicines history. So we can see the full medicines history. We can see which organisations uploaded medicines. We can see the type of medicines uploaded. And we can also see any allergies and adverse reactions that have been uploaded to the My Health Record as well. Just moving my Zoom icon there. So yes, and then another obviously key place could be, I think, you know, another key area to be aware of is the Medicare overview area. Now, a lot of clinicians tell us that they go into My Health Record and there might be very little information in there. What is hidden is the Medicare history, and that's an automatic feed. So if I look at best practice, I go to the unexclude Medicare document section and update. And then I need to do that in order to have the My Health Record Medicare overview populate. and I can open it up then and open up the Medicare overview. If you've got a thin My Health record particularly, but also for new patients, it's really important to familiarise with the Medicare overview. You get PBS history, so that's automatic feed of any medicines that have been supplied over the PBS. Immunisations record is there, but also the MBS history. So for a COVID history, we can get the telehealth consult item numbers coming through. So it can give a bit of evidence of contact with providers in the context of COVID via the MBS history. Some providers, some general practices tell us that they also use the MBS to see if the patient had a care plan done in the last 12 months, perhaps at another provider, another general practice. So that's the Medicare overview. The patient might have had a chest X-ray, in which case we can open up the diagnostic imaging overview to see any X-rays, MRIs, ultrasounds that have been done for the patient according to the date range in your document list. And we can see that there's been some chest X-rays, and we can see under the examination list for chest X-rays, there's been quite a few chest X-rays. The most recent one was at the end of March, and we can click on that to view the report. So that could have been uploaded anywhere for that patient, but you do get a list of where that took place. Of course, if the patient's had a pathology test, we can view the pathology reports in the My Health Record Pathology Reports overview. Now, if there was a pathology test done, as many of you might know, it would appear as SARS coronavirus 2 RNA or SARS coronavirus 2 with another extension. So we can get a view of all of those points of dates and just simply view the report there as well for that report. So a little bit more on pathology. So we did have a question come in via the community, APNIS community, in regards to pathology. So all the public pathology in all the states and territories of Australia is uploading at least something. So in all states and territories, most of the time when a patient just turns up without a referral to a public, say, COVID clinic, that report will go up to the My Health record. However, if there is an exception where the current setup in some states, not all, so for example, not in WA, but say in New South Wales currently, if the GP is given a referral to the patient to go to a public health clinic, the report currently does not go up. But there's a full list of public pathology, but also private pathology that uploads on the My Health Record website, which is myhealthrecord.gov.au. Something to bear in mind is that we are still near the starting blocks when it comes to private pathology. So we're doing a lot of communication to practice managers, and please let your practice manager know that in order for private pathology to go up, it does require the practice manager or your IT supplier to call the private pathology lab and request that your pathology reports are going up to My Health Record, or to check that. And that will ensure that your practice is set up for electronic requesting of pathology. So what happens there is the patient still gets the pathology request to take to the lab via the current paper process, but behind the scenes, there's an electronic request that goes direct to the lab, helps process the patient's report quicker, which means the information flows a lot quicker, smoother, and it also saves the patient having to ask your practice or the lab for a copy of their report, which we're told makes up for about 1 to 2% of all phone calls to labs, is for consumers to request their pathology report. So it helps a lot of things, not only for the patient, but for the provider to be able to view that, for example, view the pathology report should the patient present to hospital. Next, I'll briefly talk about another document you might look at. So the shared health summary. In all of the clinical software types, there is the capability to enter the fixed fields with COVID presentations. So for example, this shared health summary has a COVID item entered into the medical history to state COVID-19 isolation advice. So when you're doing shared health summaries or event summaries, you can enter in that sort of information into the fixed fields for the medical history. And similar again for event summaries. So we haven't got that example in here, but nevertheless, the similar sort of report could be in there. Some providers do upload pathology and diagnostic imaging that they've received into their inbox. So say in best practice, you can receive your reports into your inbox, same with Medical Director, and you can, with an event summary, depending on the software, can often upload a copy of that in the event summary from the general practice. So that's shared health summaries and event summaries. The patient might have presented to ICU into hospital. So we can search for the discharge summary via, we can scroll through, and there's one there from the 3rd of the 4th, 2017. But if we don't have time to keep scrolling, what we can do is just open up the document type section, select discharge summary, update, and that'll help us sort down to the discharge summaries. And so we can just simply open that up and get a report. All states and territories of Australia are uploading public, well, except for South Australia, a lot of the public hospitals are uploading. Certainly all the public hospitals in New South Wales, Queensland, WA, Northern Territory are uploading discharge summaries, and then it's a little, most elsewhere. Private hospitals are uploading, about 60% of private hospitals are uploading some sort of document. So there's a lot of hospital history going up as well. We might also want to look at the advanced care plan. So a patient that might have gone through the COVID experience, particularly an older patient like Caleb, someone may have discussed advanced care planning with Caleb. Now there is the capability to upload an advanced care plan by a patient into their My Health record. And we can view that information in the My Health record by searching in the document list. And we can view a copy of that PDF that's been uploaded by the patient on the patient side in the My Health record. Now in WA, there is a document called the Goals of Care document that can be uploaded by the provider side, but currently, excluding the Goals of Care in WA, there isn't that capability elsewhere for providers currently to upload advanced care planning documents. We can also see if there's an advanced care directive custodian that's been updated, who's got a copy of the advanced care directive. Patients can enter that into their My Health record, and then that can be accessed should it be needed. That brings me to the formalities of the end of the formalities of the discussion. Have you got any questions there, Margaret?
Hello, yes, there are a couple of questions. I'll read one out. I'm nervous about automatically going into patients' My Health record to look for things, including immunisations. Medico-legally, where do we stand in this regard? In other words, what is the correct way of using a patient's My Health record?
So you are authorised by law, primarily the My Health Record Act, which encourages the use of My Health record for the benefit of a patient's healthcare. So you do not require explicit consent to view or to upload to a My Health record if you have a reason to provide healthcare to the patient. For example, they've got an appointment with you, your practice has received a referral. That indicates that you have a healthcare relationship with the individual. What the law discourages is use of the My Health record for any other individual apart from one of your patients. So for example, sticky beaking into friends, family, relatives, etc. That is a breach. So the law discourages unauthorized access such as non-healthcare based relationships. However, you are encouraged by law to use the My Health Record for the benefit of the patient. We now have 9 out of 10 of your patients have a My Health Record. So a bit over 90% of the Australian population has a My Health Record, just a click away, just like that. So because of that, the laws allows for use of it. So for example, if the patient's waiting in the waiting room, you can view their My Health Record before they come in. If they've left your practice and you think, you're concerned that they might go to hospital, you can upload a shared health summary. Of course, a lot of providers will have a conversation with patients about that, whether you call that consent or not, that's okay. Some providers will have a form to select for patients to evidence that, but it's not required by law.
Thanks, Kerry. I'll just read another one. Our GPs are not uploading to My Health Record. I'm not clear on what general practices actually should be doing in this regard to demonstrate best practice. What can nurses upload? I think you've actually given a bit of that, some context in your previous response.
Yeah, so what we've done today with Marg and Apner is talk about what an example of viewing My Health Record. In the next event, we're going to talk about uploading. So practice nurses can upload a shared health summary. So practice registered nurses can upload a shared health summary. Registered nurses and enrolled nurses can upload what's called an event summary. So a shared health summary is a document that lists the key, 4 key fields such as allergies, immunizations, medicines, and medical history. And an event summary can have some reports, results, plus a little spiel on a point in time event. So generally for the holistic perspective, upload a shared health summary. For a point in time document, upload an event summary. By law, only registered nurses can upload a shared health summary. And general practices, most general practices are uploading at least a little bit. We find increasingly patients are asking general practices to upload something to their My Health Record. So, we've got lots of resources on our My Health Record website to support practices get started.
Thanks. So there's a question here asking, what can a registered nurse do and what can an enrolled nurse do? And I'm thinking, I'm keen for your response on this, but I'm actually thinking that in all the writings up, they talk about, nurses in primary health care or practice nurses, and that really is RNs or ENs. And a lot of documentation doesn't determine the different roles they have, and the nurses themselves need to know their scope of practice. So is there any issue in the areas where nurses can upload information? Does that apply to the enrolled nurses as well as the registered nurse?
Yeah, so it's the event summary section where you can upload something. Sorry, I've just got the Zoom camera there. So all ENs can upload an event summary. And obviously, what we recommend is have a discussion with the practice manager or the practice about how are we going to use My Health Record in our practice. But certainly in terms of what ENs can upload, it's an event summary, a shared health summary. Now that's the same health summary that you're asked to fax to a hospital today. That shared health summary from a nursing perspective can only be uploaded by a registered nurse by law, and the law for that is the My Health Record Act. Apart from that, there's no difference. So ENs that need bonus health information about a patient can view the My Health Record. Registered nurses can view the My Health Record. And again, because you're providing healthcare to a patient, you don't require explicit consent. Patients can opt out if they don't want their providers to be accessing the My Health Record. They can also set up a range of access controls, such as They can even set up SMS and email alerts on activity on their My Health record. They can see which organisations have viewed their My Health record. They can set a passcode on their My Health record and only give that to trusted health providers for access. So there's a range of controls that means that the law is very comfortable with you using the My Health record to deliver healthcare.
Thank you. The other one is I used to upload shared health summaries when I gave an immunisation. Now that the AIR is available, the immunisation register is available, does this mean I shouldn't upload because the immunisation is seen in the Australian Immunisation Register?
Good question. We certainly, well, absolutely. If that is the only purpose that you're uploading, we hear that it's roughly about 90% of all general practice immunisations get into the AIR. There could be a whole range of reasons that you're probably more familiar with than I am in regards to why that is and why that isn't. So, you know, if you are uploading for 100% of your immunisations, then you know that 100% of your immunisations are available in the My Health record. There's nothing wrong with uploading a shared health summary. Just ensure that, well, you know, if it's just uploading the immunisation only and not uploading the other aspects of a shared health summary, then we'd probably recommend doing an event summary for those points in time. But if you're able to upload the current meds, so check, you know, a lot of providers tell us that they check in with the patient, are you still taking this medicine? Are you still, you know, taking that medicine? That helps update the shared health summary. And so, you know, there's no real right or wrong in that regard. You can still upload a shared health summary there, but yeah, if it's only, if you know that it's getting into the AIR, then absolutely it's going to be available in the AIR section.
And I just want to make, somebody's put in a comment rather than a question. My Health record is a great safety tool and facilitates continuity between providers. And I think that's an important point to remember. There's been a couple of questions about how do we get our GPs to do this, and because they're not keen to upload, it's another thing that they need to do in their day. But I think that's sort of comment. Yes.
On that one, I've had you know, GPs tell me, particularly one in Bondi, that the time that she saves in viewing discharge summaries, pathology, imaging, information from other providers in the My Health record at the click of a button, rather than picking up the phone or having a staff pick up the phone and ring around and gather information all the time that can take to gather information and share information. The time it takes to upload information versus all of that time that's saved, it's a massive offset, and it's very minor in regards to, you know, so GPs that use My Health record a lot tell us that they are using it when they don't have the information at hand, and some GPs might only use it once every 12 days, you know, 10 days or so, a couple of times a fortnight. But, you know, it depends on your role, depends on how many new people you get to your practice. Do you have a lot of ones that are, you know, just come to you, or, you know, not having so much traveling at the moment, but, you know, there still is a bit of movement going on around the place. There's a lot of previously healthy people presenting to providers for the first time at the moment, because they're much more aware of their healthcare and the risk of COVID. So it really is an awesome time to be getting into My Health record. Doctors tend to look for medicines history. So My Health record has the best record of medicines history for a patient beyond your local record, plus pathology and imaging. So if you go in and find that you're finding some useful results for a patient, let your doctors know. And that's, you know, when we get that discussion going in a practice, that's when it gets used.
Thanks, Kerry. Excuse me. We'll just move to your next slide now of some further support. We've had a lot of questions coming through, so really this this Nurse Digest session, I'm sure, could actually go on for another half an hour at least, but in the interest of keeping to time, we're going to close the questions. But stay on the line because I want to tell you a bit more about how we can get questions answered. If you'd like to, if you want to know more information, you can join APNA's My Health Record Community of Practice, where you can share, you can ask questions of each other. So for you nurses and others that are working in the primary healthcare space, I encourage you to join our community of practice where you can learn from each other and ask questions. And it's facilitated by a nurse moderator, but also supported by the digital agency clinical educators as well for some further information. So if you're interested to join, the easiest way is just to get onto the APNA website, apna.asn.au, and type communities of practice, so plural, communities of practice, into the search bar, and that'll come on and you'll be able to see the My Health Record community of practice. So thank you very much, Carey, for joining us, and thank you to everybody across Australia who's joined us today. I hope that that's provided some helpful information, and we look forward to you joining our next Nurse Digest on the 3rd of September at the same time that you're viewing in now, and we'll be looking at uploading to My Health Record so we can answer some more questions then. So stay well and goodbye. Thank you.
Thank you. See you next time.